Hey, it's Dr. Trish Leigh with another Neurofeedback Q&A. Today's question is about the first neurofeedback session, what to expect in it and what to expect after it. Okay, so during the first neurofeedback session, you have to remember that you will hear positive feedback tones when your brain is in the zone, negative feedback tones if your brain gets very far out of the zone, and your screen will dim and brighten accordingly. So bright screen, positive feedback tones that sound nice when your brain is in the zone, dim screen, and dings when your brain is out of the zone. And you may not even be fully aware of that feedback. You don't have to be because your brain is. So after your session, what do most people experience? Most people experience what's called the clean windshield effect. It's like your windshield has been cleaned and things are clearer, you feel calmer and more focused. That is the most anticipated response after your first neurofeedback session. People ask me all the time, not people who come to me, but people ask me via email all the time, is it normal if I feel worse after my first neurofeedback session? Normal? No. Abnormal? It's not abnormal either. So typically if you work with a provider who really knows what he or she is doing, they can check your response to training during your session and make sure that your brain's signal activity, the way that it's functioning, is being gently moved in the right direction. Not too much and not too little. And as long as it's the just right push in training, you shouldn't have any ab reactions. So there's no side effects. The only thing that can happen is if your brain is pushed too far, too fast, then it can try to bounce back a little. And what that might look like is like any other muscle after it's been worked. So if you never worked out and then you did 100 bicep curls, your bicep might ache and it might be tired. So the most typical reaction that might happen after a first session is you may have a headache or you may be tired. And I always recommend that people take a rest after their first neurofeedback session, and honestly, if they can build in a rest after every neurofeedback session, it can be very beneficial as neurointegration happens when we rest after a session, meaning that that session will gel and will help move your brain pattern forward. In some cases, and they're very rare, a person might experience worse symptoms. Typically that happens when a significant amount of training has happened and the brain's kind of going, woohoo, this doesn't feel like it normally does, and it will try really hard to get back to its old negative brain pattern, and in doing so it kind of shoots in the opposite direction. It is called retracing, so it'll try to go back to its old pattern but in a much bigger way. That rarely happens, and typically your provider can see if a very strong response to training is happening and either cut your session short or make it a more gentle type of training for you. So I guess the takeaway there is if you feel worse after your first session, it doesn't mean stop. It may mean slow down because you want to keep it at the just right push. An analogy is I took my son for braces today and they told me that they put very thin wires on. I don't know anything about braces, it's my first experience. But anyways, the wires are thin because if they use thicker wires, the teeth would move too fast and it would upset the teeth at the roots, cause a lot of pain, discomfort, and problems for the teeth. And that made total sense to me because I do the same thing with neurofeedback training. We want to move the brain gently, especially at first, and then ramp up the training and make it stronger as a person can handle it so that we're giving them that just right push response to training to move them in the right direction as fast as we can, but not too fast. Okay, so I hope that answers your question, and this way you can get the most out of your first neurofeedback session so you can control your brain so it doesn't control you. Thanks.